The following program is a special presentation of the Big Ten Network, produced in association with the University of Wisconsin.
The issue of healthcare reform has raised the collective blood pressure of the entire nation. With so many plans out there and so many claims being made, it can often be difficult to separate fact from fiction. We'll outline the major issues and dissect the competing proposals with two experts from the University of Wisconsin-Madison as we diagnose healthcare policy and politics. Next, during office hours. Hi, I'm Ken Goldstein, professor of political science at the University of Wisconsin-Madison. After a drama-filled summer of town hall meetings, demonstrations, and even inflammatory tweets about death panels, the debate over healthcare reform is entering the home stretch. With an address to Congress and an extensive public schedule, President Obama is pressing Congress to complete work on a bill and get it to his desk this fall. Joining us today to discuss America's healthcare reform debate are Charles Franklin and Tom Oliver. Franklin is a political science professor at UW-Madison and a co-founder of Pollster.com. Oliver is a professor of population health sciences and an expert at health policy at the University of Wisconsin-Madison Medical School and School of Public Health. Tom, Charles, thanks for joining us. Charles, an old hand here at office hours, so welcome back. Tom, we're going to be spending a lot of time today talking about the solutions to the healthcare problem, but I think it would be useful for our viewers to understand exactly what the problem is that we're trying to solve.
Well, there's no question that people do get a tug in their hearts and worry about, are they next, when they hear that over 50 million Americans at this point are going without any insurance coverage whatsoever. Probably about 11 million have lost employer-sponsored coverage in the last year alone with the meltdown in jobs, and only a few million of those have gotten some other coverage through public options. But the big driver, I think, of the debate, as always, is the core increase in healthcare costs. Just in the last decade, our premiums for a family health insurance coverage has gone from under $6,000 to over $13,000. That's 3 to 4 times the general price inflation and take-home pay increases. And so basically it's eating up any increases in take-home pay that people have. It's causing employers to not hire as many workers or to even drop health insurance coverage. So I think cost is the core thing that gets people worried about themselves as well as others.
Okay, so looking at it as we judge what the problem is, we would say cost and close to 50 million people uninsured, perhaps even a bit north of that at this point. But when we ask people surveys and ask them what concerns them about healthcare, we get a little bit of a different picture.
Well, what we see in the healthcare questions is that while people are concerned about care, they're concerned about their rising costs, and as a secondary issue, they're concerned about covering the uninsured. That 50 million or so uninsured translates into roughly 15 to 18% of the population that don't have some kind of coverage, though those that are covered may have inadequate coverage or may be on Medicare or something like that. But it means that for the public at large, they're pretty satisfied with the coverage they have, and they're concerned about the escalating price of it, especially people who are self-insured, who may be owners of small businesses or entrepreneurs who are paying their own coverage rather than being covered out of a company plan.
So put another way, would it be fair to say that people can care about their own health insurance, their own cost, but don't have the macro concerns about its cost to the economy and the other people who are not covered?
Exactly, and there are two kinds of elements of that cost. The biggest one is we all know what the price of gas has done lately. Almost none of us know what our health insurance total bill really is. And then secondly, knowledge about how much of the federal budget goes to health care costs and the economy as a whole, that's stuff that ordinary citizens just have no idea about.
In a recent book about healthcare in which he traveled to other countries, T.R. Reid made the point that it's a moral question, and that the way Americans view something like healthcare is very different than people in other industrialized countries would view it. So from a public opinion standpoint, what we learned in graduate school is the American creed. how sort of the macro opinions of Americans about what the government should be involved in influence our debate about health care?
Pretty significantly, in part because people like what they have, but also because of the concern about the rising deficit, the role of the federal government. When we ask people what they don't like about the Obama health care reform proposal, the number one thing is the increase in the size and scope of government, and the second biggest one is the impact it has on the federal budget. When we ask what they like about it, covering the uninsured is high, but covering pre-existing conditions is also very high. So the considerations are quite different, mostly about personal circumstances on the positive side, but concerns against this expansion of the federal government and the costs on the negative side.
Okay. I want to get to Tom in a second and talk about how we compare to other countries, and I think we'll probably do that in the next segment. But again, how do Americans' general beliefs about the role of government differ from folks in other countries, and how might that influence what we're talking about now with health care?
Many industrialized countries, mostly Western Europe, but some elsewhere in the world, Japan for example, are much more willing to see the federal government take this role and see it as a core function of government. Here in the United States, we have been so reliant on employer-provided health care, especially post-World War II, that we don't really think about alternatives. The big irony often pointed out in the health care debate is one of the groups that's most concerned about reform are seniors who are covered by Medicare, a government-run health care plan. And that irony is not lost on reformers.
And we're going to have a lot of conversations about seniors. Tom, we're going to go to break now. When we come back to you, I want to talk about how we compare on some nitty-gritty things with folks in other industrialized Western democracies. So please join us in office hours as we discuss healthcare reform.
This program is a production of the University of Wisconsin-Madison. If you have comments about this broadcast, please email them to programming@uc.wisc.edu.
For more than 100 years, the University of Wisconsin has been inspired by the Wisconsin idea,
which says the good work of the university extends to the boundaries of the state and beyond.
So the UW works hard to help build Wisconsin's economy.
Educate people of all ages.
Advance health and medicine.
And enhance the quality of life for all of us.
Hit it! The University of Wisconsin-Madison. Forward thinking.
Welcome back to Office Hours. Joining me are Charles Franklin and Tom Oliver, and we're trying to shed a little light on the heated debate around healthcare reform. Tom, take me through how other countries do it. A Britain, a Canada, a Germany, a Japan, when it comes to providing health care for their people?
Well, I think to pull back to what would be wrong enough with our system to suggest that we ought to go forward with some kind of health care reform, and why the American people overwhelmingly think we do need some major restructuring of our system, it really comes down to three basic areas of access, cost, and quality. And you know, if I were answering a multiple choice exam as a student, I'd have to say it's all of the above that are problematic for us today and, well, heading into the future. First of all, compared to all the other advanced industrial nations, we are the only ones who don't provide either direct health services or health insurance to all or nearly all of our citizens. We've got, as we mentioned, probably over 50 million Americans without any coverage, many, tens of millions more with very inadequate coverage. Secondly, on costs, we are 60% more expensive than the next costliest country in the world, Switzerland, and we spend twice as much per person as most of our economic competitors, you know, Germany, France, Japan, and other advanced industrial nations. And that shows up in our bottom lines and our business operations as well. And thirdly, even on the question of quality, Many experts believe that we rank well below many other countries in terms of the overall quality of our healthcare systems, and certainly we're down, well down the list in terms of infant mortality, life expectancy, and even, back to the question of Medicare, even once you make it to age 65, our life expectancy for people with universal coverage through Medicare is still shorter than in other countries. So we have a wide range of big problems that suggest we need a much better performing healthcare system.
Anything we're doing better on than other countries?
We have a better record of, if you've got a particular problem, will you get the state-of-the-art care? And the answer there is yes. You've got the best chance in the U.S. of getting the state-of-the-art care. But on virtually everything else, unfortunately, there's better ways of doing things.
And that state-of-the-art care often comes at a pretty high cost. And we have another quote from T.R. Reid, two quotes from him today, who just did a comparative study of healthcare systems. And he writes, while the U.S. lets some 700,000 people go bankrupt due to medical bills each year, the number of medical bankruptcies in Canada is precisely 0. So that's another issue here.
It's a individual expression of the overall societal costs, that these are not just somebody else's economic agony, but it's actually hitting many Americans, and it is really the leading source of bankruptcy over the years at this point in time.
Objectively not a terrific record in comparison to other countries. When we look, though, what Americans think about it, it's difficult to say whether they're for healthcare reform, against healthcare reform. It very much depends on how the question is phrased, right?
It's extremely sensitive to how the question is phrased, what the alternatives are, what alternatives are posed, and how they're expressed or framed in the question. You can find questions about healthcare reform with upwards of 60 or even 70% favoring a public option, for example. But you can also find phrasings that go to the public option where support is in the low 40s or even the high 30s. So there's a wide range. What it really reflects is that the public is not very well informed about the issues of healthcare reform, even after all the time we've been talking about it. And as a result, they're sensitive to the way questions are framed, but they're also sensitive to the political arguments that leaders on both sides are raising. And so, in a peculiar way, it means people may be very energized and angry about the issue, but they're also not that clear on what in fact is being proposed, and they're not all that clear about how it will affect them, but they're more and more pessimistic about how it'll affect them.
Okay, let me jump in, and when we come back, we'll discuss American-specific attitudes. You mentioned the public option and other sorts of specific things. Please stay with us. Office Hours, we continue our discussion of healthcare reform. Welcome back to Office Hours. Joining me are Charles Franklin and Tom Oliver discussing healthcare reform. Charles, August is usually a sleepy month in Washington, a sleepy month in politics. It was not a sleepy month this past August. Town halls, demonstrastrations. Talk to me a little bit about what changed over the summer, and was there an effect of this drama-filled August?
Yeah, August is when we have stories about sharks or shark attacks. This year it was about town hall meetings. What we saw was the mobilization of opposition. Very vocal, very engaged, very loud. But what we didn't see was a major movement against healthcare reform. In fact, the surprising fact is that opposition to reform had risen throughout the spring and through June and July, but it essentially plateaued in August and has remained relatively flat since the first or second week in August. Meanwhile, support for healthcare reform, which had trended downward, though not as sharply, into June and July, stopped going down in August and actually turned up a little bit. So that where we find ourselves today is, in the latest trend, 46% for healthcare reform, 47% against. We're at a dead heat on this. And again, this means that political leadership is going to be key to whether it passes or not.
Tom, with lots of competing plans out there, and with Obama not formally actually having an Obama plan, what do I make of it when I hear half are for health care reform, half are against health care reform? What do you think that means?
Well, I think, building on what Charles said, the health care town meetings were a target of opportunity for individuals with grievances about the economy, about foreign affairs, about the budget deficits and so forth. And it is not all about opposition to health care, in part because, as we said, people cannot be fully informed easily about such a complex and comprehensive set of proposals. But what I think the polls are telling us is that in part it's a referendum on the president and his ability and faith in him to address the problems of the country. But it's a little misleading because the president, as we said, doesn't have his own plan. Building on lessons learned from the Clinton administration, he has let leaders in Congress with far more experience on health care issues formulate programs and policies and package them together and actually cooperate inside the House of Representatives and the Senate.
But nevertheless, when he then goes in front of Congress finally and says, okay, I've let Congress handle this, and maybe overlearning the lessons of the Clinton battle, do you think from a public opinion standpoint he then takes ownership of health care reform?
I think it comes to him. He certainly tried to do that with his speech to the joint session. We saw a little bit of short-term movement immediately after the speech, but no indication that it really changed the terms of the debate, that it really restructured people's thinking about what he was proposing, what he was supporting.
And part of that, I think, is the fact that some of the opposition nominally, when you simply say, are you for or against, or do you support the president's role in health care reform to this point, a lot of people are really disappointed that they're not going to get a stronger health reform package because of the need for compromise and getting the number of votes needed in the Congress to get a bill to the president. And so I think we're capturing a lot of dissent that's now starting to play out in reaction to the protests against health reform. There's protests for health reform, but a stronger brand of health reform than what the president has laid out and insisted upon. And so I think that's where we're at, is that we have a reaction to the blatant misperceptions or intentional distortions, and people have realized this isn't going to be a victory parade, but they would like more than they probably are going to get from this, a fair number of Americans.
Okay. Tom, Charles, thanks. In our last segment, we're going to come back and talk about some of the nitty-gritty of what a reform plan could look like. Please stay with us on Office Hours.
For more than 100 years, the University of Wisconsin has been inspired by the Wisconsin idea,
which says the good work of the university extends to the boundaries of the state and beyond.
So the UW works hard to help build Wisconsin's economy.
Educate people of all ages.
Advance health and medicine.
And enhance the quality of life for all of us.
Hit it!
The University of Wisconsin-Madison. Forward thinking.
This program is a production of the University of Wisconsin-Madison. If you have comments about this broadcast, please email them to programming@uc.wisc.edu.
Welcome back to Office Hours, our discussion of the politics and policy around health care reform. So, Tom, 5 committees working on it in Congress. We have various bills in various stages in each house. There is actually some substantial agreement among the 5 committees and the 5 bills that are in play now. Where's the agreement?
Absolutely. The agreement is we need stronger rules about what insurance companies are able to do and not do about accepting customers, getting rid of customers, jacking up the premiums on sick customers, and we need to have more choices available to most individuals who may only have a single plan through their employer. We've got much more agreement about the need to help people if you're going to require them to get insurance, which most of the bills do.
So each bill requires some sort of individual mandate that people will have to have health insurance.
Exactly, and with some hardship exceptions and so forth, but for the most part, everybody's going to have to go out and get some insurance. And so you have to help them pay for it because of the costs we've talked about.
And where are the difference? Where are the roadblocks now?
The roadblocks are really around how many people are we going to end up with being covered. And in the Senate Finance Committee bill really contemplates leaving maybe 20 million Americans uninsured, whereas the Senate Health Committee and the House of Representatives bills really envision everybody having coverage, essentially.
And what are the differences in how the different bills would pay for health care reform?
Well, it's pick your poison. Do you want to tax really high-income Americans, or do you want to tax expensive health plans? Those are two opportunities that are being debated across. And the other one is how fast can you slow the growth of Medicare and Medicaid, which are vast expenditures in our health system. And that's where the source of a lot of the savings, really going after payments to doctors and payments to insurance companies that are participating in Medicare and Medicaid.
Well, let me ask about that cost question to Charles, because big possible cost of cost savings is in Medicare, some of the more expensive extra plans around Medicare. That's going to have an influence on seniors. From the public opinion data, what do we know about seniors and health care?
That they're the most skeptical group about the health care reform. They're worried that it will damage the kind of coverage they get under Medicare, and they are opposed to reform when they're concerned that they're going to lose benefits.
And seniors vote.
And seniors vote. Young people who might be supportive because they're not covered tend to, in the first place, not participate as much, not vote as much, but also a lot of young people choose not to be insured, and so they represent one segment of the uninsured population that doesn't actually feel the urgency of getting coverage. And that's the other irony here, is that of that 15 million uninsured, a non-trivial percentage are people who really do it by choice rather than by necessity.
I'm sorry, I only got about a minute left, but talked a lot of policy, a lot of politics, opinions about Obama, opinions about health care reform. What's the nitty-gritty that's happening now in terms of who's going to make the decision, which senators are important, and how this translates into a bill?
Well, the key thing is, do you get 60 Senate votes to pass over a filibuster? And that requires 60 healthy senators. Democrats nominally have 60 seats, but Senator Kennedy's seat is vacant, at least for the moment, and there's some health problems. Olympia Snowe, the one Republican that Democrats have really designed the plan around to get her vote, need her to give both the 60 votes and the cover of at least one piece of bipartisanship. And in the House, they have to worry about Democrats recently elected from moderate to conservative districts who are very afraid of having to go home and run for re-election in 2010 if they vote for health care in their districts.
Tom, Charles, thank you. I think I just looked at my phone as I walked in, and I think the governor of Massachusetts just appointed a replacement for Ted Kennedy. Thanks for talking about health care reform. Lots to follow in politics. From the University of Wisconsin-Madison, this has been Office Hours. Thanks for stopping by.
The preceding program was produced by the University of Wisconsin in association with the Big Ten Network.